Good afternoon or good morning, depending where you are in the country. Welcome to our February advocacy update. My name is Kim Beer. I'm the Director of Public Policy here at the Foundation. And I want to just first by welcoming everyone, but also acknowledging that it's so wonderful to see my colleagues on camera today. We want to thank everybody who's always filled out our surveys and our requests for improvement, and some of the feedback we received is that you'd like to see us. So we hope one day we'll have technology where we can see everybody and be able to facilitate a webinar together, but hopefully this will make the experience better for everybody. And so thanks again for your feedback. Let's get started. We have a really good group, and today's webinar will be focusing a lot on congressional updates and Paralysis Resource Center funding for FY22, including updates on administration, testing, and masking guidance, as well as what we'll look forward to as midterm elections come up later in the year. We'll focus a little bit on our advocacy priorities, and we'll spend time later in next month and the month after that going over some of these priorities more in detail. My colleague Chris will talk a little bit about a GMO agreement. Representative Langevin from Rhode Island, who is a huge advocate for the disability community, has announced his retirement. And we'll give some grassroots updates as well as take time for questions. And we'll also address some of the questions that we received prior to the webinar. So we thank so much for all of those who filled out a question beforehand. And again, I'm so grateful to have my colleagues on this webinar with me, Celicia Lomax, from a Senior Associate from Waxman Strategies, and of course, John Sawyer from Senior Advisor, and my colleague Chris, with whom you communicate very often. We will again monitor the questions as well as send you the recording and any information we reference throughout the webinar. And I think I'm going to pass it over to my colleague, John.
Great, thank you so much, Kim, and thanks to everybody for joining today. I think it's an interesting time in Washington with a lot of things starting, a lot of things finishing, a lot of things potentially somewhere between starting and finishing. So we wanted to make sure that we were giving you all the latest updates from here in the nation's capital. So we spent so much of last year and really since the beginning of the Biden administration talking about what has now become known as the Build Back Better legislation. This began last year as President Biden's two proposed plans after the rescue plan. It was his American Jobs Plan and his American Families Plan. The American Jobs Plan largely focused on physical infrastructure in the country, and the American Families Plan largely focused on sort of social spending and climate spending and sort of those domestic policy investments. The Jobs Plan largely became what became known as the bipartisan infrastructure package that passed last year on a bipartisan basis with, I think, over 60 votes in the Senate. And then most of that second plan, the American Families Plan, became what was known as the Build Back Better Act. And all the way up through the end of last year, there were sort of changes and momentum, and eventually the House in November of last year passed its version of the Build Back Better Act, a $1.7 trillion piece of legislation that contained a range of different provisions on healthcare, on social policy, on climate, on taxes and other things on a very narrow margin at the end of November. We've talked about on previous webinars sort of how December ended, which is that the Build Back Better Act in general, I think it's fair to say, is stalled in the Senate, despite having the most provisions having the support of 48 or 49 senators, or all 50 Democratic senators. This bill, which is a bill that can pass with that slim partisan majority of 50 votes, does not have the support of all 50 Democratic senators to pass as one package. And most prominently, and therefore pictured here, is Senator Joe Manchin of West Virginia, who around at the end of December publicly shared his concerns with the legislation and basically said that in its current form, it was something that he was unable to support. And so I think after going away for the holidays, coming back, focusing on a handful of other issues that we will talk to, I wish we could say that there was more progress toward an eventual agreement on at least whatever provisions of the Build Back Better Act Senator Manchin and 49 other Democratic senators could agree to. But it feels like that point is still quite a ways off. Senator Manchin has said the bill is dead in its current form and that they need to start from scratch in the negotiations. That being said, I think there are a number of provisions that were part of that package that do have the support of 50 senators, including Senator Manchin. And if there is the political will to come back together and figure out what a package can look like, I think that still is possible to accomplish this year. But as is conventional wisdom in Washington, the longer it takes for a bill to move through the process, especially in an election year where every day this year we get a little closer to that moment, and Celicia will talk about this later, where members of Congress leave Washington and go home to campaign. Every moment it gets closer to that, it becomes harder and harder to pass big and complicated legislation. So I think it's fair to say, as we said, Build Back Better itself as a large package is fairly stalled. We are continuing to monitor this legislation, all the different pieces that go into it, but in particular, the Reeve Foundation and our team have, and advocates around the country, both Reeve affiliated advocates and advocates from other disability groups with whom we partner, all of us have remained very, very focused on the provisions in this bill related to home and community-based services under Medicaid. And what those would do is really help provide funding to states to help clear some of the waiting lists that they have for home and community-based services, increase access to those services, as well as include some wage protections for the workers providing those services. All told, those home and community-based services provisions in the Build Back Better Act total about $150 billion in the bill that passed the House. And as we understand it, remain pretty popular in the Senate. So if a package is to come back together, we'll be advocating, along with many others, that those provisions remain in. But the outlook on when that will happen remains a little bit unclear. And then if we go to the next slide, we can talk about sort of what's the biggest piece of work that Congress has in the meantime. As folks who've been on our webinars before know, one of the things that Congress has to do every year is complete the annual appropriations process. That starts early in the year with the president's budget proposal. It continues through the spring and the summer, last spring and summer, with the appropriations committees creating their work product and really deciding on their recommendations for funding levels for almost every program in government. One of the programs that we focus very directly on in the Reeve Foundation is the Paralysis Resource Center program, of which the National Paralysis Resource Center is actually operated by the Reeve Foundation. And so we've been tracking that process all year. Technically, Congress is supposed to finish the federal appropriations process before the start of the fiscal year, which is October 1st, would have been October 1st of last year, the start of fiscal year 2022. But it has been, I think, over 20 years since Congress has actually done that work on time and completed the appropriations process before October 1st. So that process for the current fiscal year, of which we're already several months in, is still unfinished. There is a current, Congress is working under a current continuing resolution, which is essentially when government funding gets put on autopilot and extended at existing levels. And that continuing resolution goes through a week from Friday, the February 18th. And so there is the possibility, albeit slim, that Congress will figure out how to pull together an omnibus piece of legislation. In other words, bring all the pieces of appropriations legislation together on a bipartisan basis to fund programs for the rest of the year. There is also a more likely possibility that if they're not able to meet that deadline, they will kick the can even further down the road. And we are already starting to hear proposals in the House that they will potentially pass another short-term continuing resolution into March before they are able to come to final agreement on this. I think for those of us who don't live and breathe this process every day, that sounds pretty crazy to say, like, okay, we're 5 months into the fiscal year and still trying to figure out what the final funding levels are for all the programs in the government. I would say to those of you who feel that way, you're right. This is a pretty crazy way to operate, and it's just become the norm because there are so many issues involved in not only how much money gets spent overall, but also what policies are attached to the appropriations bills. That working out a final deal on these, especially a bipartisan deal, which is needed, can just be very, very complicated. So again, we're following the National Paralysis Resource Center. We are confident, based on what the House has done and what the Senate has done, that if Congress finalizes FY22 appropriations, whether that's in February or March, there will be an increase in funding for the National Paralysis Resource Center. It depends a little bit on whether they go with the House plan or the Senate plan. And we can even go to the next slide just to give some context to these numbers. But overall, what we've seen over the last few years, again, thanks to amazing advocacy from all of you around the country, is a steady increase in the investment in the National Paralysis Resource Center and the Paralysis Resource Center program overall, which funds mostly the national, but also assorted other programs. There has been a steady increase in funding, and both House and Senate have called for a further increase in funding this year. So we will see what happens when that is final. And we will obviously keep advocates up to date. And I know Chris will talk about some of the advocacy engagement that's coming up around this, given sort of the calendar piece. But those two pieces are really the main things I think we're focused on. We'll talk about a handful of other things further into the webinar, but that's sort of where Congress stands at the moment in terms of the big, broad Biden agenda legislation of Build Back Better, and then the annual appropriations process, which we're following for a number of priorities. With that, I will turn it over to Celicia, who's going to give a little context on how the midterm elections influence the congressional calendar and vice versa.
Yeah, thank you so much, John, for that. And again, thanks to everyone for joining us. As if that wasn't already enough that's going on in this year, we also, as you all know, are coming into an election season, and midterm elections are supposed to be happening this November, but primaries actually in the states will be beginning as early as next month. And so Texas, for example, starts in March, and there's a number of other states that will be starting with their primaries. And as we get into November, we'll see all of that sort of trickling into effect. There's a number of members of Congress, of course, facing elections this year. As you guys can all see in this map on the right-hand side, this is looking particularly at the Senate. There's 34 members within the Senate that are up for elections. And then, of course, in the House, that's all of the House members. So that's over 400 folks that are up for re-election. So they really want to ensure, of course, that they'll be engaging with their districts as frequently as possible. And that means that over the course of this year, we may see many of our members of Congress starting to go back to their various regions to interact with and engage with their constituents. That, of course, means going back to what John mentioned around different pieces of legislation moving around in the appropriations process, that as we get further along into the year, it will be harder to engage those members of Congress as they'll be working to go back to their districts and make sure that they're engaging with their constituents. So this could, of course, mean that there is pressure amongst a number of our members of Congress right now to make sure that certain bills and legislation that they've been championing and like so far gets passed. And part of that means that we on the advocacy side, want to make sure that we're also pushing forward on the areas that we find particularly important. And that's where you can really engage with your members of Congress. And of course, as I mentioned, this could result in delays as things get pushed later in the congressional calendar. For example, as we get to September, as folks will really start to be doing more of their campaign travels for their various states. So we'll want to make sure that we look out for that and pay attention to it. It does mean that there's quite a bit of a sprint right now that's happening as we're in the winter and going into the spring. And likely we'll see more of a trickling off directly into district engagement in states as we get into the summer and fall. I also wanted to speak a little bit to testing and mask guidance from the administration. I know that it's been quite confusing at times since there's been different guidance that has come out. I'll just talk a little bit about what's coming from the CDC and broadly some pieces of advice or recommendations that kind of go with that. And so on the mask guidance side, of course, the biggest piece there is to wear a mask as often as you can, especially when you're indoors and surrounded by large groups of people, and making sure that it's something that fits well for you and is comfortable to you. There are recommendations right now as far as more protection around N95 or KN95 masks, just because it's better in sort of filtering out so that there lessens that exposure to COVID-19. But generally, it's just important to wear something that you feel comfortable with and that you can definitely wear while indoors. And broadly to that point as well, people don't have to wear masks when they're outdoors, but just thinking in general, like anyone that's 2 and older, especially if you're not vaccinated, it's ideal to wear a mask in order to stay on the safer side and protect yourself and others around you. On the testing guidance side, this has been changed around quite a bit. The newer guidance from the CDC is that after, if you do have COVID-19 symptoms, then you can have 5 days of isolation instead of the longer 10-day period from before, after that sort of known or suspected close contact to someone else that may have COVID-19. And this is especially important for those that may be going into their workplaces or going into school to have that isolation. But a piece of that too is after those 5 days, it would be helpful to also make sure that you get tested an additional time to make sure that you do have a negative test result to return to work or to return to school. Of course, as I mentioned, with that positive result, that's the isolation time, and that may extend. If you test again and you test positive, you may have to extend that time of isolation. But if there's a negative result, then you can return to those normal activities, that work and school activities that you may be involved in, and make sure that you also wear your mask indoors. I'll just add to that too, that the Biden administration put out that they're sending free COVID tests, at-home tests for people, at-home rapid tests, and you can get up to 4 per household. If you haven't had an opportunity to take advantage of that, I do highly recommend it. I'll just put a link in the chat for those if you'd like to get those at-home COVID tests. You'll be able to get that. It's pretty easy to sign up. There's only 4 tests per household, so there could be some challenges there if there's a number of people that may live within one house. But at least with this, there will be 4 COVID tests that come to your home that you'll have access to. So just wanted to speak on those because I know it has been a little bit confusing, but just want to make sure that overall we're staying as safe as we can and protecting ourselves. So I will pass it over to Kim to talk a bit about the 2022 advocacy priorities.
Thank you so much, Celicia. I really appreciate that. And John. And before I get to our priorities, I just want to also add that feel free to refer to our website. The Reeve Foundation updates our COVID-19 materials and information that comes from the CDC and ACL, the Administration for Community Living, on a daily basis. And we recommend you review that, and also, of course, stay in constant communication with your doctor to make the best decisions for yourself to stay safe. And we also hold monthly webinars with Nurse Linda, who is a nurse who has dedicated her life essentially to working with people who are paralyzed or impacted by paralysis. And she takes questions on those webinars every month. So feel free, we'll make sure that you have the next webinar's information. In case you have more specific information, oh great, it's right there in the chat. In case you have more specific questions around COVID-19 or any health related issue. Okay, thank you for that. Great, so let's just talk about our advocacy priorities. And before we get to them, I just want to acknowledge that there may be some new individuals on the phone. I want to welcome you. I was remiss in doing that in the beginning of the call. And I want to also thank our advocates who continue to show up every month. So I just want to say thank you for that. We've made a lot of progress, even during this very difficult time when most of us spend our lives behind a screen. And I want to say that your advocacy and your work continues to make a difference. And we really, I really, on behalf of the foundation, want to thank you. Many people ask the Reeve Foundation, well, how do you determine what you focus on? And of course, you do have to make a priority list because you can easily get pulled in many different directions and not be very effective at all. And so we, the foundation, tries to focus on priorities that they themselves can have, an impact on and that are of importance to the foundation in advancing its mission and helping individuals who come to us for assistance. But also we work with other organizations to advance ancillary but equally important issues. We work a lot in coalitions, and I'll talk about that in a minute. Every congressional cycle, so we actually be doing another survey at the end of this year in anticipation of a new Congress. We survey the community and perform a community needs assessment about what's important to the community around public policy issues. And we use that as a guide for the way we set our priorities. So we're still utilizing the survey that we sent out 2 years ago that helps us inform our priorities. And oftentimes you'll see that we carry over priorities from the year prior because number one is an annual important advocacy issue, or two, it takes longer than a year to accomplish something. And in many instances, it can take many years. But with tenacity and consistency, we can move the needle on many of these issues. So I just wanted to lay that out there. So for those of us who have been a part of the foundation and advocated on behalf of the foundation, we all know that the National Paralysis Resource Center is our #1 priority. We are entering into our 20th year of operating the Paralysis Resource Center. We are very proud and privileged to have been entrusted with this role. As you know, we competitively bid for this grant every 3 years, and currently we're in a 5-year grant cycle. So we're in the first year of a 5-year grant. And every year we have to ask Congress to ensure that the dollars are there so we can perform our work and expand our services. So as John reviewed, we're still in the middle of FY22, and then we'll start work on FY23. And we'll keep you posted again on updates around the continuing resolution and closing out FY22 so we can move on to FY23. That's our #1 priority. Our second priority is overarching. We want to make sure that we are advocating for the preservation and improvement of accessibility policies and statutes, especially around civil rights for those impacted by paralysis or may have a mobility impairment. And we have worked very closely with Paralyzed Veterans of America, United Spinal Association. There are many other organizations that are involved in a coalition that is trying to advance the adoption of the Air Carrier Access Amendments Act. And we spent a lot of time last year educating the advocates on this bill. We can include our old webinars on that in case you're not familiar with this bill, but we'll continue to advocate for it in the new Congress. And it'll have to be reintroduced. So all of the work that we've done, we have to make sure we carry it over into the new year. Into the new congressional year. Priority 3, again, this is a really big one and it's really important. And there are many different issues that can fall under this, to improving insurance coverage for treatments, devices, rehabilitation, and home health care for those impacted by paralysis. And just one example under this priority is improving coverage within Medicare and Medicaid. And currently we are working with a very large coalition of organizations, providers, researchers, to have Medicare acknowledge standing feature and seat elevation, not only as a benefit under durable medical equipment, but to also cover it. And we've been working on this issue very closely, again, with organizations like United Spinal, Spina Bifida, Multiple Sclerosis, Paralyzed Veterans of America, to advance this issue toward in front of Medicare. So we'll continue to work on this. We had a very important meeting at the end of last year with the director of Medicare and really pled our case again. And we will keep you updated. You really helped us last year because we asked you to get your members of Congress to sign onto a letter that we sent actually to Medicare, to CMS, highlighting the importance of this issue, not only for the community, but for also representatives too in their districts. So thank you for that. The fourth issue is around research. And I know I've mentioned this in the past. The foundation has to do a better job educating all of you about what research is happening and how we can best advocate for it. And this year we are working closely with the United Spinal Association. We hope to have them on a future webinar. We're collaborating and amplifying their efforts that they've been working on for many years around increasing federal funding for SCI model systems, which is within an agency, actually within ACL called NIDLR, and which is headed up by a ally of the foundation, Dr. Anjali Forber-Pratt. And so we are thrilled to be working with United Spinal. And in fact, we sent out earlier, within the last 2 weeks, an action alert, which Chris will report on, asking Congress to increase funding for this agency. And we'll go into more details about what that entails in a future webinar, but we're excited to work more closely with United Spinal. We know many of our advocates overlap with many different organizations, and we need to work more closely together. So we're excited for that. We get a lot of questions about, so what are these coalitions and what do they do? Some of the names of these may not mean a lot to you, but I would say that we are aiming to improve rehabilitation stays, improve access, and improving Medicare coverage, as I mentioned, around standing feature and seat elevation, but we are also working with partners, Spina Bifida Association and United Spinal, as I mentioned, PVA, to improve, to gather information around improving coverage for catheters as well. We want to increase research, as I said, and we work on many different task forces, the Consortium for Citizens with Disabilities, that we are able to track issues around housing, healthcare, transportation, and so it's really been a great experience to participate in these coalitions, to not only represent the foundation, but also to work together. As John and Celicia have always mentioned, and Chris, we can't do this work alone, and we have to move some of these, as I mentioned, ancillary, but equally important issues in organizations together and not alone. So I just wanted to highlight some of those coalitions. And I think I'm going to pass it over to my colleague, Chris.
That's right. Thank you, Kim. So picking up where Kim left off, talking about some of our coalition work, we wanted to take a moment and just give a brief overview of the Jimmo Agreement and how knowledge of this particular agreement could be helpful for you in your own self-advocacy around home health care. So one of the coalitions that we work with includes our friends at the Center for Medicare Advocacy. And a couple of weeks ago, we were on a call where they, asked some other groups if they could help amplify this issue around Jimmo, because on December 2nd of 2021, CMS, they sent a Jimmo reminder to 200 plus healthcare organizations that they contract with, reminding them of the Jimmo Agreement and, what it clarified around the use of skilled nursing and skilled therapy at home. So for those of you that are unaware, the Jimmo Agreement was the result of the Jimmo versus Sebelius lawsuit. It was a nationwide class action lawsuit in 2013, and it was brought against the Center for Medicare and Medicaid Services on behalf of individuals with chronic conditions who had been denied Medicare coverage on the basis that they were not improving or did not demonstrate a potential for improvement. And what the important thing that the agreement clarified was the Medicare program covers skilled nursing care and skilled therapy home health to maintain function or to prevent a slow decline. So in other words, for your own knowledge and your own self-advocacy, restoration potential is not the deciding factor on Medicare home health coverage. And what the law covers is up to 28 hours, less than 8-hour days a week, any number of days covered under the law. And I think that part of the reason why this was brought up and there was this reminder sent out is because as the Center for Medicare Advocacy explained on one of their own webinars recently, many people are getting denied services and only receiving 1 to 3 hours of home care per week. And there are lots of factors that go into that, some of which, we would hope would be cleared up by the investment in home and community-based services through the Build Back Better Act. But forgetting the Jimmo agreement or not being aware of the Jimmo agreement could be contributing to that as well. So we wanted to pass that along to all of our advocates. Let me know if you have any further questions about this issue and we can help you get more information, but it's important to keep in mind that key factor, restoration potential, is not the deciding factor in Medicare home health coverage. So if you're told that, you can rest assured that it's not accurate, and you can reach out to us or the Center for Medicare Advocacy if you need help dealing with any of these issues. And furthermore, another piece of information that we just wanted to cover briefly here at the top, we got some bittersweet news in January that Congressman Jim Langevin was going to be retiring at the end of his term this year. We are so proud at the foundation to count Congressman Langevin as an ally in our advocacy efforts. As many of you know, he's been a lead sponsor on the Dear Colleague funding letter around the Paralysis Resource Center, which we share with offices at the start of every appropriations season. And I know he's been on it in the past few years. I'm not sure exactly how many years Congressman Langevin has been working with us on that issue, but he's been a steadfast ally there. And he's also the lead sponsor on HR 1696, the Air Carriers Access Amendment Act, which we've been talking to you about over this past year. And I know that some of you have even brought that issue to your members and asking them to co-sponsor that bill. So that came out of Congressman Langevin's office. He served in Congress for over 20 years. He was the first quadriplegic to be elected to Congress and the first to serve as the Speaker pro tem, which is, up at the top of the dais, holding the gavel when the votes are coming in or managing debate around a particular bill. So we just can't say it enough. We're so thankful for his allyship and the service that he provided to the foundation and the disability community as a whole. And he will be missed. And just before I move on, I don't know if John or Kim, if anyone else had anything that you guys wanted to add around working with Congressman Langevin.
Go ahead, Kim.
I just wanted to say, we still have this year, so we're already bidding him adieu, and we will work very closely with him this year. But I would say that Representative Langevin has been a steadfast supporter and advocate, and knew Chris Reeve directly. So we are so grateful for his contributions, and he has worked consistently to support all of our issues, including funding for paralysis and the Paralysis Resource Center.
And the only thing I'd add to that is just, and this may be my bias as a former congressional staffer, but one way a really good member of Congress is they also have really good staff. And in the time that I've worked with Congressman Langevin's office and with the foundation in particular and his office, they have had a terrific series of staffers, including some really long-standing staffers. And I think there's a lot of focus right now in Washington on congressional staffers and how hard they work and under what conditions. And I think his office has always been well known as one that has been a good place to work and a rewarding place to work. And so, and we've always had a really good experience with his staff as well. So we'll hope that they land in a good place after this year, but looking forward to spending the rest of the year working in partnership with them.
Well said. Thank you both for adding that perspective. So getting into the grassroots update, just want to let you know how our last action alert has been performing and to preview another action alert that we plan to have out sometime this week around the PRC. As Kim mentioned, we did send out an action alert related to the spinal cord injury SCI model systems. This is a new issue for us. SCI model systems, they're sponsored, as Kim mentioned, they're sponsored by NIDLR, the Administration for Community Living, and the Department of Health and Human Services to support innovative projects in research and delivery, demonstration, evaluation of medical rehabilitation, vocational, and other services to meet the needs of individuals with spinal cord injury. And last year, this was in July, when the House of Representatives passed their Health and Human Services funding bill, which we've communicated with many about already. They also included nearly $12 million for NIDLR and $2 million of those dollars to increase the number of SCI model systems nationwide. So in our action alert, we were asking Congress for the Senate and the House to agree on the FY22 funding levels with NIDLR and this SCI model system funding increases. And we put that out about a week ago. And as of this morning, we had 562 advocates who took action on that alert, and they sent 1,741 emails to Congress asking them to ensure that this funding increase is included in a final spending bill. So really happy to see those results, especially because this is a new issue for us. It's not one that we have communicated in great detail with you all about yet, but if you want to take action on that one and you have not yet, we will be sure to include the link there in our follow-up email to you all. And then be on the lookout, because as I forgot to mention, we are working with United Spinal on this issue. So we are hoping that in a future webinar, we will have someone from United Spinal with us to come and talk more about this issue and educate us all further about the importance of this program and why it needs to be funded. And then moving forward, for this week, we are planning to have an action alert out around funding for the Paralysis Resource Center. Again, in that same HHS spending bill from last year, that included higher funding for the Paralysis Resource Center. But then in October, as was mentioned, the Senate put out their own draft language for appropriations, acknowledging the PRC's effectiveness at helping people with paralysis live more independent lives. And they recommended to fund the Paralysis Resource Center at no less than $9.7 million. So I know on previous action alerts, we had been urging you all to get Congress to adopt the House's language. As this process moves forward, we're pivoting here, and you'll see on this upcoming action alert that our ask is that Congress pass an FY22 appropriation bill that includes the Senate language funding the National Paralysis Resource Center at no less than the $9.7 million. So that's something that we should have out in the next couple days. So for the next steps around this issue, just watch your inbox for the action alert. I will also remind you all that when we send out our action alerts, you are able to edit the message that you send to Congress. So when you get the alert, if you want to fill in, if you have a story of using the Paralysis Resource Center, or if you have a personal experience to talk to the value of this program, then you can add that into the message before you send it off to your member's office. So keep that in mind, that you can tell your story there. And then we would ask that if you have an active social network or people that you work with who you think would be interested in taking up this issue as well, to feel free to share that link to that action alert and really help amplify our efforts there and get as much communication to Capitol Hill as we can. So be on the lookout for that. We have that finalized and should be out in the next couple of days. And finally, the last update that I wanted to give you was around the air travel issue that we've been working on for the last year. You may remember last October as well, I was sharing with you all a survey that we co-sponsored along with some other organizations, including the Paralyzed Veterans of America, their survey on the air travel experience of passengers with disabilities. That survey got 1,262 respondents. And overall, I think it confirmed what a lot of us already knew about the experience of air travel for people with disabilities, in particular people with paralysis or spinal cord injury, or who may otherwise rely on a wheelchair, that air travel is a fraught venture for many people. Some highlights from the data, 66% of the respondents did say that they fly 1 to 2 times per year. But of those 66% who do fly 1 to 2 times per year, some of the reasons why they avoid air travel altogether: number one, 73% said the potential damage to a wheelchair was the number one reason for why they avoid air travel. 62% say access to lavatories, and 54% said the safety in transferring to an aisle seat. So this was kind of encouraging data because, as you may all know or remember, the Air Carriers Access Amendment Act does directly deal with all 3 of these major issues to help make air travel more accessible. Amongst the passengers who do use an aisle seat, some interesting statistics there. 47% said that they did not feel the personnel was properly trained. 43% said that they have felt unsafe in the aisle seat. And 11% of people said that they were in fact dropped when they were being transferred from their chair into an aisle seat, which I think these are statistics that really speak to the urgency of this particular piece of legislation. And furthermore, if air travel issues were resolved, 60% of people said they would fly multiple times a year, and 15% of people said that they would even fly monthly. So, we know that this air travel issue is one that has been picked up by the national press over the last few months, and we've seen lots of really heartbreaking stories told through news reports. This data, like I said, while it may just confirm what we sort of already knew about air travel, we feel like it's important to have handy, as Kim mentioned, when this bill needs to be reintroduced into the next Congress. And as we've been talking with you all about preparing for possibly getting this bill included in FAA reauthorization, having this data with us when we go into offices and talk to members will be key to really educating members and their staff about why this issue is so important and why it's one that needs to be taken up and passed as soon as possible. And just lastly here on this slide, Kim was talking about some of the coalitions that we work with, just to highlight some of the other groups that were involved in this survey and working on the Air Carriers Access Amendment Act with us in our working group, Paralyzed Veterans for America. As you know, Cure SMA, the National Disability Rights Network, United Spinal Association, and those are just a few. So this is really a collective effort, and we're going to rely on all of you advocates on this issue and the other issues that I brought up here in this grassroots update going forward this year to get these things done. So thank you. I will take any questions that you might have for us.
Chris, we do have one question. I just wanted to add around the travel issue. Sounds like a little bit like we're wishing for next year. The important part here is to gain as many co-sponsors as possible because it makes it that much better when we do reintroduce it around the FAA reauthorization. So yep. If you could ask your members of Congress to co-sponsor it, because as many as we can get this year will only help us in the future. So I just wanted to add that.
Thank you, Kim. Yes, indeed. And any questions that you have around reaching out to your members around that issue or funding for the PRC or spinal cord SCI model systems, I will be sure to include my email in our follow-up. And I'm the policy and advocacy coordinator here at the foundation. Happy to help you set up meetings, answer any questions that you might have around any of these issues, so that we can all continue to keep the momentum up and working together.
There's one question that I want to address, maybe two, let's see. Yes, so the first question is around what is the process for how the PRC funding allocation and the competitive process for applying for the grant? And then of the $9 million, approximately right now it's 8.7, what goes to the Reeve Foundation to operate it? So prior to this grant cycle, which we're in the first year of a 5-year grant cycle, prior to this one, it was a 3-year competitive grant process. And so every 3 years, the Administration for Community Living, and prior to that, it was the CDC, would release an FOA, which was a funding opportunity for any organization to respond and apply in response to this funding opportunity, and how best they would answer the questions, and in this instance, how best they would operate a paralysis resource center. So the Reeve Foundation and other organizations compete to, and then independently are reviewed. It's not people in HHS just determining, it's an independent review process with the scoring rubric that analyzes every application and makes a decision of how they award the grant. We were awarded the grant this year. We're very proud and honored to continue our work. And as a result, we do have this advocacy priority, and that where we need to ensure funding through Congress. And this is, again, as I mentioned, our #1 priority. The $8.7 million comes to Reeve, meaning that we use that funding from Congress to operate the resource center based on the requirements that ACL lays out for us. And we have to submit 2 reports a year, a year-end report. We'll have to submit a 5-year report showing our outcomes and our impact. And we meet monthly with our project officer at ACL. So we've gotten questions around, from individuals and advocates who work with different organizations, where and how they should advocate for. So this is a personal decision, based on what your priorities are as an individual and whatever organization you're aligned with. But we would love for you to continue to advocate for funding for the Paralysis Resource Center. And we don't see this as a conflict with other organizations. So I hope that answers your question. We really appreciate your support on the question there. Let's see. The other question is, are we still collecting stories? Yes, around travel. I believe this is Sherry. If that's the case, Chris, can you just put your email again in the chat box? And we can certainly collect any travel stories that you have, or any stories in particular that you want to share with us, and we can collect those. And then we have a logistical question around action alerts. When we get an action alert letter in our inbox, is there a way to have a web link, or do we just have to forward the letter by email? Chris, are you able to answer that?
I think so. So when you follow the link, when you get the action alert, Sherry, everything will be auto-populated, and then you can either just type in your name and your zip code so that your letter goes to the right to your actual member of Congress, and you can just send it off as it is. Or, as I mentioned, you can edit the text box that you'll see is auto-populated when you open the action alert. I'm not sure about adding a web link to that text box. I haven't had an experience of anyone trying to add a link there, but you can edit it to add your story or to add other information that you think would be relevant around the issue. So you can edit the message. I'm not sure about a web link, but also happy to talk with you, Sherry, offline about this more. If you have some questions about what it is that you would like to include or what specific link you're thinking of. So I'll add my email to the chat here and we can connect.
I think if any other questions, feel free to put them in the Q&A or the chat box. I think, and I looked at the questions beforehand, I think we've answered everything. And if you haven't, feel free to reach out to Chris directly. We'll send the recording of this webinar and the materials we referenced in the upcoming events at Reeve. We really appreciate your attendance and your dedication to our work, and we hope to see you next month.